Hello, I'm Ann Ricksecker, and I'm the chair of the board of directors at Prevention Point Philadelphia.
I'm Maggie Stoeffel, and I chair the Community Service Committee of the Rotary Club of Chestnut Hill.
Prevention Point is a 30-year-old nonprofit public health agency in Philadelphia that provides a wide range of harm reduction programs, primarily to promote health empowerment and safety for communities that are affected by drugs. Our services range from a low barrier shelter that sees about 100 people to a drop-in center that sees thousands of people in the course of a month. Obviously, syringe exchange, which was our initial founding program. The human condition for people who have found themselves addicted to drugs is such that the decision-making and quality of life is completely challenged. And many people believe that they should just stop using drugs, that they are weak because they can't stop using drugs. And if anyone has known anyone who's had a struggle with drugs, and many of us know people, we know that it's very complex. The notion of folks who are dependent on drugs being weak is actually the opposite. The folks that we serve about 36,000 people a year, are incredibly strong and resilient in many ways. That they can survive at all is a remarkable stamp.
Opioid addiction specifically could happen to any of us. So if you don't care about this population per se, almost every family knows somebody that had a sports injury, was given prescription pain meds, and then went down the very slippery slope. And it's very easy to find oneself in that predicament. So all kinds of reasons to care and to try to help. And one of the things I like so when you do go down to Kensington, it's easy to become overwhelmed and hopeless, thinking we're not going to solve this problem. And maybe we're not. And what I love about Prevention Point's mission is, as Ann said, it's a harm reduction mission. They aren't trying to, maybe they'd love to solve the problem, but what they're doing is, first of all, keeping people alive to the point that they can seek the help that they need. Dead people can't seek services. If you can keep them alive, then maybe you can get them on the path that they need to health. That the mission of Prevention Point is worthy, and it's a hard one, and we really support what they're doing.
The folks that we see in Kensington, and we have sites all over the city actually, but Kensington has become, really known for its drug market. Because it's an open air drug market, it is visited by people all over the region. More than 50% of the people that we're serving are not originally from Kensington. A lot of them are from the collar counties, and they get trapped. They get trapped in their drug addiction, and they're not able to think clearly enough to leave or do anything else. So one of the things that was, one of the efforts that was organized by some leadership at Prevention Point is called the Regional Overdose Prevention Coalition, where we could begin looking at sharing data from county to county, and hopefully someday arrange for folks who are from Bucks County in Kensington that we're linking up to treatment, getting them back to Bucks County, as an example.
Last year, the kitchen was shut down at Prevention Point due to COVID, and we did snack bags instead. So we collected the ingredients of snack bags. We had a lot of fun getting together as a Rotary Club and filling these snack bags with nutritious food and tying them up in bags, and then we brought them down and delivered them. So that was last year. And this year, we went back to the chili, and we collected, oh my gosh, I don't know how people this chili is going to feed, but we collected a lot of food, and even more response to our warmware collection because we've started networking with different parts of the community. You know, we reach out to our friends and then they reach out to their neighbors or they reach out to their book club, and it's starting to really scale.
We would not be able to do most of what we do without the generous donations of items and resources from agencies like Chestnut Hill Rotary. The weekly donations that come in provide us with the ability to have food for people that come to the drop-in center, warm clothing for people who come in and have nothing on their backs, and other supplies that really make their lives far healthier and happier.
The thing that's so heartwarming is the right word, but you feel really good when you make your deliveries to Prevention Point. First of all, some of the clients of Prevention Point and other volunteers and staff members greet you at the door. They come rushing out. You open the door of your car and somebody's eyes light up with what it is that you might have. It could be the humble peanut butter and jelly sandwich, or it's a coat. And I remember, I think it was 2 years ago, I pulled a coat out of my car and it literally went on the back of a person that moment. There's none of that anonymous, I'm dropping off bags and boxes of things and who knows what happens to it. You see the need and you see the appreciation. Yesterday, I pulled 2 pair of crutches out of the car and an amazing reaction that a gentleman said, yes, and reached for them. That was what he needed, was a pair of crutches right then.
All right, we'll take it where we're going.
Everything we deliver gets used right away. When we delivered some boxes yesterday, Sarah, a nice gal who was meeting us at the door, said, this will be distributed this afternoon. And that it makes a difference to know that what you're doing is making an impact in someone's life. It's amazing when you just share the appeal that we're doing. People just need to be asked, and they really feel good about stepping up.
Thank you guys so much.